Hello everyone, welcome to the oncology topic for the day. Today we will be discussing about Burkitt's lymphoma. Now we all know that Burkitt's lymphoma is between by chromosome translocation between 8 and 14. But what you should actually know is that there is a gene that is involved that is present on chromosome 8, that is CMYC. Now this gene can be translocated with any of the immunoglobulin chains. If it's translocated with the immunoglobulin heavy chain, which is present on chromosome 14, which is the most common one, that's when the chromosome 1 translocation 814 occurs. But if the CYMYC gene is translocated either with kappa chain, that is light chain, or lambda chain, both of these are light chain, then also Burkitt's lymphoma can occur. So Burkitt's lymphoma, most common translocation is 814, occurs in around 85% of the cases. This is a scenario in around 85% of the cases, but rest 10 to 15% of the cases, the CYMYC gene present on chromosome 8 is translocated with some other chromosome which is present in the immunoglobulin light chain. If it's with kappa, that is present on chromosome 2, 28, or it's lambda, then it is 822. How did I remember this? See, kappa, it's K, Y2K. The current century that is going on is 2000, 2K. So kappa with 2. And lambda is, as the name suggests, lambda lamba. So 22 is the bigger out of 2, right? 2 and 22, lamba chromosome by 22. So that's right, 822. Now there are three forms of Burkitt's lymphoma: endemic, sporadic, and the one associated with immunodeficiency. Endemic is present in Africa. Sporadic and obviously it can occur anywhere. And immunodeficiency one is associated with mostly HIV. Now, where does it occur? Most important, the site of this lymphoma. Endemic tends to occur in jaw. Sporadic occurs in mostly in the abdominal lymph nodes. Most common site is ileocecal, while immunodeficiency can involve both the lymph nodes and bone marrow. Just a brief about the history of the disease. Actually, this disease is named after a doctor called Dennis Burkitt. He was a surgeon and he was posted in Africa and he saw a lot of children presenting with jaw masses. When he realized that these are actually a type of lymphoma, initially he actually called it sarcoma of the jaw. If you actually read the original 1958 paper, he actually called it sarcoma of the jaw, and he saw that this is the most common cancer affecting the children in the equatorial Africa. So that is the endemic form of the disease. This endemic form is almost always associated with EBV. Immunodeficiency one is associated with 40%, and the sporadic is around 20% associated with EBV. Now pathology. Now in pathology, we all know this has the classical starry sky appearance. Now, but why does the starry sky appearance happen? Now see, Burkitt lymphoma is a very aggressive tumor. Because of this 814 or 822 or 82 translocation, the tumor cells are dividing extremely rapidly. Now when these tumor cells are dividing extremely rapidly, some of these tumor cells will undergo apoptosis. They will go apoptosis, very rapid division and apoptosis. These apoptotic cells inside the lymph nodes will be engulfed by the macrophages. And what you will see in this picture is that these all blue cells that you're seeing, these are multiple, like this lymph node is full of tumor cells which appear blue, and these are macrophages which are engulfing small apoptotic cells. So what will happen that in a background of these blue cells, there will be some clearing by the macrophages which will be engulfing. They will be lipid-laden macrophages. They will be engulfing this apoptosis cell, and this will give rise to the classical starry sky pattern. As you can see, so this is the background will be blue because it will be full of these tumor cells, and then macrophages will be engulfing, and they will appear as white. And this white in the background of this dark blue and black is the starry sky pattern. Now, bone marrow, we'll see this lymphoblasts, and they will have a distinct nucleoli. As you can see, they are distinct nucleoli. Then they will have royal blue cytoplasm. This color is royal blue with vacuoles that will be present as far as the bone marrow and the blasts in the bone marrow are concerned. Most importantly, the immunohistochemistry. Now, Burkitt's lymphoma is derived from germinal center. It's a mature B cell lymphoma. It's a mature B cell. Now, what are the markers of mature B cell? See, CD10 and CD19 are also present in lymphoblastic leukemia, acute lymphoblastic ALL, which is the immature B cell. So, CD19 and CD10, they obviously will be present because they are present even in the pre B cell. So, mature mein to honge hi. Now, as they mature, CD20 becomes positive. And since it's the fully mature form and there will be surface IG as well. So, surface IgM also will be positive and BCL6 will be positive. So remember this is very important as far as the IHC is concerned. This concludes the oncology topic for the day.